Dr. Omar Marar, a colon and rectal surgeon at Central Michigan University Health, has witnessed major advances in minimally invasive surgery during his career. From laparoscopic techniques to robotic-assisted systems, colorectal surgery has evolved toward greater precision, improved visualization, and better patient outcomes. The transition from traditional open surgery to laparoscopic procedures marked a major turning point in surgical care. Smaller incisions reduced pain, shortened hospital stays, and improved recovery for patients undergoing colorectal operations. However, early laparoscopic surgery presented challenges such as limited instrument mobility, two-dimensional imaging, and surgeon fatigue during complex procedures. Despite these limitations, laparoscopy laid the groundwork for the integration of advanced technology into modern operating rooms. Robotic-assisted surgery further expanded the possibilities of minimally invasive care. Robotic systems introduce three-dimensional high-definition visualization, tremor filtration, and articulated instruments that replicate the movement of the human wrist. These advancements proved especially valuable in confined anatomical spaces like the pelvis, where precision is essential during colorectal and rectal cancer procedures. According to Dr. Marar, robotic systems allow surgeons to achieve levels of control and visualization not previously possible with standard laparoscopy. The improved dexterity of robotic instruments can help preserve delicate nerves and vascular structures, which is particularly important in rectal cancer surgery. Preserving autonomic nerves may significantly influence bowel, urinary, and sexual function after surgery, ultimately improving long-term quality of life for patients. Robotic platforms also improve surgeon ergonomics by reducing physical strain during lengthy operations, potentially improving consistency and performance throughout procedures. Minimally invasive and robotic-assisted techniques have changed recovery experiences for many patients. Smaller incisions reduce tissue damage, while precise dissection may decrease blood loss and postoperative complications. Many patients are able to resume normal activity more quickly compared to traditional open surgery. Enhanced recovery programs, including optimized anesthesia, early nutrition, and faster mobilization, further support better outcomes after colorectal procedures. Research continues to evaluate long-term oncologic outcomes, complication rates, and healthcare costs associated with robotic surgery. While robotic systems require substantial investment, supporters argue that improved precision and visualization may reduce the need to convert complex procedures into open surgery. For patients, successful outcomes often depend less on the technology itself and more on the experience and judgment of the surgical team using it. As an educator and clerkship director, Dr. Marar has also observed major changes in surgical training. Residents and fellows now learn robotic-assisted procedures as a routine part of education through simulation labs and structured console training. However, he emphasizes that robotics should complement sound surgical judgment rather than replace it. Surgeons must still develop a strong understanding of anatomy, pathology, patient selection, and operative decision-making. The growth of robotic innovation has also raised ethical and economic questions regarding cost, access, and equitable care. Hospitals must balance the expense of robotic systems against measurable clinical benefits. Dr. Marar stresses that technology should support evidence-based practice and patient safety, rather than serve as innovation for its own sake. Not every procedure requires robotic assistance, and careful patient selection remains essential. Looking ahead, minimally invasive surgery is expected to continue evolving through advances in imaging, artificial intelligence, augmented reality, and instrument miniaturization. Robotic-assisted surgery represents another step in the ongoing effort to improve precision while maintaining the core principles of surgical care. Dr. Marar believes the future of surgery will depend not only on technological progress, but also on the expertise and judgment of surgeons who apply these innovations responsibly.